All right, welcome to Chapter 9 for Exercise Leadership 2. Let's get to this. All right, so we're going to talk about joint stability, joint mobility, moving efficiently. So joint stability is to maintain control of your movements in different positions, and mobility would be basically your range of motion, right? So the more range of motion you have, the more mobility you have, so on and so forth. Joint stability is going to be a combination of the control you have either based on the joint itself being less mobile versus things like the shoulder and hip having and ankle having a lot more mobility than things like the knee and elbow. And again, within each joint, do you have a lot of mobility or not, right? Um, so this book likes to simplify things down to these 5 principles of movement: bend and lift, single leg, pushing, pulling, rotational movements, right? Again, there's a lot of other things that go into things, and there's a combination of those that can also happen as well. But it's ACE, they like to simplify. Again, they look at these things in their movement efficiency: active systems, which would be the muscles; passive systems, joint capsule ligament; neurosystems, proprioceptors, motor units, and arthrochomatics. I'll go into your sensory input, motor output, which equals joint mobility and stability, and your movement efficiency. All right. So again, looking at the different areas, your glenohumeral, which is shoulder mobility; scapulothoracic stability; thoracic spine mobility; lumbar spine stability; hip mobility; knee stability; ankle mobility; foot stability. Right? Again, it's a real simplistic look at each area, right? Muscle and balance attribute to. So these are things that you got to look at. So anything you do repetitively, anything you do awkwardly, your work environment, side dominance, poor exercise techniques, imbalanced resistance training programs like always skipping leg days or always doing push versus pull, congenital conditions, scoliosis, pathologies, arthritis, for example, structural deviations, tib torsion, femoral anteversion, or any trauma, surgery, injury, amputations. Can lead to altered muscle physiological and neurological properties, can compromise mobility stability relationship, can lead to the law of facilitation in the body, where it achieves the desired movement following the path of least resistance, which can then lead to dysfunctional movement and inevitable breakdowns wherever you have weak areas. Now, again, this is a lot of complexity trying to boil down to something that's very simplified, and this does not work because, again, we can't fix the fact that people do repetitive motions. We can fix the fact people do them awkwardly or in bad postures, other than, as we've talked before, like a pitcher that throws sidearm or things like that, because that's where they make their money. So we're not changing that. Or somebody does some awkward things in different sports and things like that because it gives them some competitive advantage. We're not fixing that. Work environment. You may or may not be able to have any control over that. Side dominance. You have no control over that. Poor exercise fatigue. We have control over that. Imbalanced resistance training programs. Good trainer can help you with that one. Congenital conditions. You can't fix some of those, right? Or actually most of them, to be honest. Pathologies, maybe we might have some influence on some of that, depending on what it is. Structural deviations, sometimes different, having better posture and movements and things may help some with that. Trauma, again, you got to deal with those things, and sometimes things will improve, sometimes they won't, right? So again, because of that, we can't help some of the inevitable breakdowns that happen at the end. We can't help some of the dysfunctional movements. But again, we can always work to do better, right? So understand that. So sarcomere overlap, again, they really don't go into muscle tension and all of this very good in this book. Again, when we go into phys, it'll make more sense. But yeah, they do like a little quick snippet of linked tension relationship. But they're basically what there is there's a tension where and again, if you get down to the really individual muscle fibers where the actin and myosin have good contact and control, and they're not overlapped too much, and they're not too far apart based on being stretched, you have your muscle tension. Typically, like if you think of your joints, especially like if you think elbows and knees, best position when you're doing the curling motion is right around that 90%, like somewhere in there. It's not at 90 for everybody, but it's kind of in that area, right? Again, there's a range of if the muscles are too short or they're too loose or lengthened or stretched, where you don't have good sarcomere length, and there's a healthy normal range. So again, this looks at folks that are over tense, shortened muscles versus those that don't get used at all, or very little, and they're stretched out too much, and they don't have they're low on strength, high on stretch, or vice versa. And there's a healthy range. Now again, depending on what you do in your sports or your activities and things, there's reasons sometimes for a little shortened on some, a little lengthened on some things, but yeah, there's a good range, right? Force couple. So again, this kind of shows you with hip flexors. We can see this in shoulder, hips, everything else. You have areas that are pulling down while other areas are pulling either like up or to the left or to the right, all at the same time to create a rotational movement, right? And so we have these force couple relationships. Well, they can be good, they can be bad. If you can have things with the right amount of tension, they have the right strengths, they're pulling in the right directions, everything's great. Problem is when you have some areas that are a little bit too tight, some areas that pull too much, some areas that are weak, so on and so forth, it can cause you some issues. Right, so that basically breaks down that entire slide. Neural control. Again, your brain tells your muscles to do what they need to do, right? And so again, teaching them to do correct movements, like learning correct movements and altering, incorrect movements to correct movements, helps in having good neural control. And again, eventually your brain to body will have that learned period. Again, it's not an exact science, but there's always, coaches always like to tell you like the 21 days, which usually about 21 days of doing a good habit, you start to develop the good habit versus and break the old habit, right? Things like tonicity are increased with shortened muscles requiring smaller, weaker nerve impulses to activate the contractions. When you activate an antagonist, reduced irritability threshold of agonist may prematurely activate the muscle and inhibit the antagonist actions. And hypertonic muscles decrease neural drive to the opposing muscle. So basically, again, they're making the argument that like if you're always doing push things, do pull things. If you're doing biceps, do triceps, things like that. Because again, it can basically over time you got a weakened joint, or your movement patterns aren't going to be very good, right? You're going to have muscles that over dominate and other ones that allow are more passive, which can cause some mechanical issues over time, right? Again, I'm not saying the book's wrong. It's just the overemphasis, and really they talk about the problems without, and as you get through this book, the solutions aren't really very great based on the way they do things in this book. Okay. Again, muscle imbalance. It's really hard to define what that is. So again, I'm not going to get into it. We talked about length tension. We talked about altered force coupling. Sometimes a little bit of it's okay. If you got too much one versus the other, that's where you see problems, right? Again, like I said, it's never been quite perfect because we're not quite perfect. We have side dominance. We have things that we overdo based on what, what we get paid to do or what our normal daily activities are. You can't overcome that. All right. Again, altered joint mechanics. There's what's proper for a proper mechanic or proper for your body, and then there's what you do because that's what you have to do, or there's just poor mechanics, right? So it can, like you can have like, okay, here's what you should be doing. Here's what you do. Like I said, like a pitcher, somebody does it this way because it makes them highly successful. Then there's just straight up wrong, right? And it's not like there's A, B, or C. It's the spectrum across that. Okay. Which leads to altered neuromuscular control and function. Sometimes that's good, sometimes that's bad, depending on what you need and what you want. Postural misalignments and faulty loading. The way that they, like, again, you may have some misalignment that's necessary based on what you do. Most of the time, we do not want that, so that is typically bad. Excessive musculoskeletal loading. Again, yeah, you want musculoskeletal loading. We don't want excessive, and again, leads to pain, injury, or further compensation, which again goes back and adds more to the muscle imbalance issues, right? So stability and mobility training, muscles that act primarily as stabilizers generally contain greater concentrations of type 1 because you don't want them to fatigue. Again, training, sometimes will make things seem more type 1 versus type 2 as well. So again, it's not just, there's what you're born with and there's what you train. So understand that as well. What you do is going to play into that. Muscles that are primarily responsible for joint movement generate larger forces, generally contain greater concentrations of type 2. And again, like I said, depends on what you do. If you're always doing cardio, you're a long distance runner, biker, whatever, you'll see some shift, some more mitochondria, things like that. If you're doing power, quick things, the muscle fibers, shift from, A to X versus X to A, and so on and so forth. So, yeah, understand the physiology is important, right? Strengthening muscles to improve posture. Initially focus on placing client in positions of good posture. Begin with a series of low-grade isometric contractions. Goal is to condition postural muscles that typically contain greater concentrations of type 1. Fibers with volume as opposed to intensity. Again, you can take this way too far, as this book is about to show you. Again, having people just, you can correct their posture, have them stand there while they're doing other things and just keep correcting. Or you can, if you feel like they have weakened muscles that aren't helping, you can help them to strengthen particular muscles as well. All right. So looking at proximal stability of the lumbar spine, your core muscles typically help to stay aligned there. Mobility of pelvis and thoracic spine. Again, you can work on flexibility. You can work on movements through full ranges of motion using correct movement patterns, so on and so forth. Proximal stability, scap thoracic, glenohumeral. Again, there's movements we can do for that. Again, you can concentrate on doing things with normal movements as well. Distal mobility, stability, again, same thing, and static balance. Again, core muscles, again, if you're standing, things like that, legs got to be, they've got to be able to stay positioned, so on and so forth, good balance, center of gravity, so on, right? So, stretching before exercise. Deconditioned client with poor flexibility, muscle imbalance, myofascial release, warm up, static stretch. Again, there's the myofascial release stuff. There's a lot of mixed review out there. Kind of depends on the person. Some people love it, some people don't. I've got nothing against it. I think sometimes some of the benefits are over exaggerated because the research doesn't back it. But again, and sometimes, worst comes to worst, sometimes it just feels good to do, to be honest. Again, whether you want to do that before or after is going to depend on the client, what they're going through, so on and so forth. Warm-ups, always prior to exercise, you want to do warm up. Static stretches, depends on the person. Again, sometimes you don't want to stretch them out too much because of what they're about to do, okay? Conditioned clients, again, they can do myofascial if you want. It just depends on them. Again, dynamic stretches and warm up are always good. And then performance athletes, again, ballistic stretching, that's one of those things. It's not really necessary. Again, we don't want to do a pre-exercise, doing static stretch. You should always do warm up prior to doing everything, to be honest. Even before you do myofascial release, you should really warm muscles up before you start stretching and doing all that stuff. Again, stretching cold muscles is always a bad idea, and you see that they kind of take that out with the performance athletes, which warm-ups is a huge part of performance athletes, so I don't know why they'd have that out. And again, especially before you would do any dynamic or ballistic stretches, you would want to warm up. During exercise, when you're exercising, the stretches should come as you're doing the movement. So I don't know if they're, the way the book writes it, it just happens. It doesn't really need to be purposeful. It's just going to happen. And then afterwards, post exercise, well, if you're trying to gain flexibility, myofascial release, PNF stretching, again, you've got to have somebody that's trained on how to do that to stretch you out, or for you to stretch somebody else out. And static stretches, again, all for purpose of gaining more range of motion, right? So whenever we're either getting stretched out too far, or if you've got too heavy of a weight, we have two things to try to help you from tearing muscles. We've got the Golgi tendon organ, and you've got the muscle spindle, right? So again, when you have a simple muscle stretch reflex, the stretch of the muscle spindle causes the reflex to happen. So when you're getting stretched out, if it feels like it'll flex. And then on the other hand, you've got the Golgi tendon organ will cause reflex inhibition. So again, this is the one, like if you got too heavy of a weight, it'll kind of relax the muscle to try to help. And both are there. They're kind of, now again, they don't always work and they don't always keep you from tearing something, but they're kind of built-in safety devices in the muscle sensory to try to help you from tearing, right? Self-myofascial release. Again, a lot of this is overstated in here, but fascia can lose pliability with physical trauma, scarring, inflammation, which is true. Damaged fascia can exert excessive pressure on underlying structures, cause pain, limited range of motion. True, again, a lot of times you don't know if it's that or not. Could be, you could have bruised muscles, so on and so forth. Self-myofascial release applies pressure to tight restricted area of the fascia, underlying muscle, and attempt to relieve tension, improve flexibility. Again, whether or not it's releasing the fascia or you're rolling out, tight muscle and everything else, or a combination of all that, is really probably a better and accurate depiction of what's going on. Again, foam roller, small ball, you can control your own intensity. And again, it can be painful. So again, she's doing hamstring and glutes using foam roller and a ball. Proximal stability, or like if you think of core stability, these are the muscles involved. So transverse abdominis, multifidus, quadratus lumborum, deep fibers internal obliques, diaphragm, pelvic floor, adjoining fascia. Again, these along with your other core muscles such as your abs and obliques will help with core stability. balanced spine, imbalanced spine. So again, it shows you where some are getting stretched out, some are pulling too tight on the right. Balanced spine, you should have good tension. Again, it's not quite that simple to I mean, again, there's times the way that you're standing or doing things, or the way you sit, where certain muscles will be activated a bit more than others. Doesn't always mean front to back or left to right. It's just the position, like you may be in a standing position, or if you're holding something, right? So if I'm holding something out in front of me, my back muscles are then to counterbalance what I'm holding in my hands in front of me, are going to have to engage a bit more. Now, if I have a backpack on, my anterior muscles may have to engage more to keep me from wanting to sway backwards, right? So again, those are all things that come into place, okay? The hoop tension effect is similar to that of cinching. So as all the muscles, as they cinch around, they create stability around the entire midsection of the body, just like if you're cinching a belt, right? Is the theory, okay? So again, it's core and balance training. So they got these stages. Again, you can do all these at different points of exercise during different exercises. So activating the core, emphasizing stabilizers during certain movements, and dynamic balance. I mean, you don't have to go from A to B to C, or stage 1 to 2 to 3, right? We can work on all these just depending on where somebody's at, what they can and cannot do, so on and so forth. Yeah, most people have back pain. It's the number one most complained about pain in the body. Some folks will have chronic or reoccurring, or you'll have different bouts of acute. Anyways, yeah, so again, you want to promote healthy backs. How do you do that? We avoid doing stuff that would injure the low back. We have them do things that help to promote good posture while they're lifting, strengthen low backs, cores, yeah, like all that, right? I mean, it's just built in the program, okay? So again, you can do, here's some different exercises you can do. A lot of times I don't do these necessarily as exercises, because again, when I have them do things such as like crunches or sit-ups, or like med ball things and stuff like that, we do the drawing in, because sometimes people have trouble controlling this, and they don't know what it feels like. So this is a great exercise to have them do at some point, just to learn what this feels like to do, right? So again, pelvic floor contractions, TVA contractions, combination of both. Again, with breathing, without breathing, holding their breath. These are all great for learning how to control muscles that they may or may not have ever really figured. Again, a lot of times people have trouble contracting things because they don't know how to feel for it and engage certain muscles, right? Again, drawing in while like you do Supermans, is another good exercise you can have them do once you've gone from one to the other. Again, I wouldn't spend more than like maybe a few sessions like teaching the techniques, because once they figure out how to engage those muscles, and really that's really what you're wanting them to do, you can incorporate them into their normal lifting movements, right? So again, I picked this as the last thing we go over. The rest of the book really just kind of gives you like a brief glance into things. And again, this does too, but I wanted you to see, again, with your clients, you got to kind of give and take with where they're at, what they want, what they need. Don't just put them through a bunch of exercise gauntlets just because the book tells you to. Because again, if you're missing the point of why they're there in the first place, they're not going to stick around. Okay. So that's it for chapter 9. And yep.